Okay, welcome everybody. Sorry about the little pause there. You get these technical difficulties. I'm Simon Griffiths, the Director for Adult Social Care for Basildon and Brentwood, and I'm also the lead for carers and the sponsor for the carers programme. So it's really great to see you all on the screen today. Hopefully a few more of you join in a little while. I know there's overlapping meetings, so it's great to have you here. I'm just going to do a quick introduction, then I'm going to hand over to Jill. So welcome to the second series of webinars. There was one that was held yesterday, and we've got another 3 throughout the week. So it's great. We're going to have a real packed week of webinars. Just a little bit of housekeeping. The session is going to be recorded as usual, so it can be played back later for the people who couldn't attend. And there is a Q&A function on Teams if you have any questions and comments throughout, and people will try and respond throughout the webinar. If they can't, then we can get back to you later if there's some answers we don't know. But we'll do our best to respond live. We have some absolutely superb speakers today, and I thank them all for coming along today to join this webinar. We have Jill from Essex Wellbeing Service, who's going to talk to us in a minute first. Then we've got Lisa from the Action for Family Carers. Then we've got Emma from Carers First coming, and then Jack from Essex County Council Adult Social Care Connects. So once again, thank you all. It'll be really interesting to listen to what you have to say. And then in a minute, I'm just going to introduce you, once I've handed over to Jill after the video, I'm just going to introduce you to a video which summarises some of the main places to go for the support, which we'll explore further in the video. So I think it's the video next, if I'm right. Thanks all.
Caring for a loved one can be challenging, but in Essex, you're not alone. We're committed to working with our partners to make sure unpaid carers get the support they need. Our Essex Carers Core offer is provided by 2 dedicated services. Carers First supports unpaid carers in Mid and South Essex, covering Braintree, Chelmsford, Malden, Rochford, Castle Point, Brentwood and Basildon. Action for Family Carers, in partnership with Essex Carers Support, supports carers in West and North Essex, covering Tendring, Colchester, Uttlesford, Harlow, Epping Forest. These services can help with information and advice, practical solutions for specific challenges, support groups, connect with others who understand, emotional support, help coping with the emotional challenges associated with caring, counselling, a safe space to share your feelings with trained professionals, small wellbeing grants where eligible, to take a well-deserved break and more. Some carers may need additional support. That's where Adult Social Care Connects comes in. They can help with carers assessments to understand your role and needs, technology-enabled care, emergency planning, direct payments for identified support needs. There's no wrong door. If you're an unpaid carer and need support, reach out. We're here to help. Contact Adult Social Care Connects 0330 135 137 or 0330 135 139 or visit www.essex.gov.uk/carers. Action for Family Carers www.affc.org.uk and Carers First www.carersfirst.org.uk.
Morning everyone, hello. My name is Jill Hopkins. I'm the Carers Pathway Lead at the Essex Wellbeing Service. Essex Wellbeing Service provides a central point of contact for adult carers. What we give is actually offer a confidential phone call with one of the trained care navigators to discuss their situation as well as their own health and wellbeing. So when carers don't know where to go, Essex Wellbeing is certainly the place to start. We work with the carer and the care navigator will help to identify needs and find the right support and advice that hopefully will help prevent a crisis situation arising for the carer later on. EWS and our care navigation partners, we have various organisations that can support with a whole multitude of health and wellbeing support for people. So that would be stopping smoking, with weight management, reducing alcohol consumption, increasing physical activity, improving balance and mobility. We also offer free health checks to people aged 40 to 74 to help identify any risk of developing CVD, like cardiovascular disease, kidney disease, type 2 diabetes and certain types of dementia. We have specialist health coaching for adults from disadvantaged groups, and we also deliver tailored support programs for children and their families to help them to live a healthy and balanced lifestyle. We have services that support with overcoming social isolation and befriending services, which can be a factor for carers. And we can also offer advice on managing debt, employment benefits and gaining employment skills. And we have services that provide basic home adaptations, such as key safes, grab rails, chair and toilet raisers, showering sort of support equipment. Along with Essex Fire Service, we offer free home fire and safety security checks. We can support with applications for assistive technology, things like personal safety alarms, and the 24-hour emergency monitoring response service is also part of the EWS support services that we have. For carers and their loved ones who are struggling to get out and about, a team of Essex-wide community agents can visit them at home, and they can help to assess and arrange for various services, the ones that I mentioned before, and they can be put in place for them as well. So they'll do the assessments and they'll arrange for installation. And they can also help with things like blue badge applications and benefit applications, and they can advise on local community and hospital transport options, as well as where it comes to isolation, they're all locally based people, so they know about social clubs and activities that will be available nearby. When we need more specialist information and guidance for carers, as we mentioned in the video, we'll then sort of pass it on to the specialist providers. As was mentioned, that's Action for Family Carers, Carers First. But if it becomes apparent on that phone call with the care navigator that the needs of the person are more urgent and more specialist or complex, that's when we will actually put the referral through to ADO Social Care Connects, and I think Jackie will be talking to us a bit later about that. With regards to anybody who's referred to Essex Wellbeing Service, we ask anyone at that point that we have that discussion with them whether they have any caring responsibilities. Some people don't necessarily identify themselves as a carer, but we ask if they look after anybody, and if they say yes, we'll advise that there is support services for them. If they don't require anything now, that's fantastic, but we will let them know about support, and we'll also send a text message to that person with an online carer support service, which is commissioned by Essex County Council, which is mobilised. So just to raise awareness of people, if you've got caring responsibilities, there is support out there. And I'll pass you on now to Lisa.
Thanks, Jill. Good morning, everyone. I'm Lisa McKay, and I'm the Adult Services Manager at Action for Family Carers. As Jill said, where more personalised support tailored to carers' individual circumstances is required, carers can then be referred to the relevant carers' services. In partnership with Essex Carer Support, Action for Family Carers have been commissioned to deliver support for adult carers over 18 in West Essex, which is Epping, Harlow and Ottersford districts, and in North East Essex, which is Colchester and Tendring districts. Carers First deliver exactly the same service in Mid and South Essex. In summary, the commissioned service provides information, advice and guidance, brief solutions-focused interventions, peer support groups, and grants for wellbeing. Each time a carer is referred to our service, we have a holistic conversation with the carer to enable us to understand their situation, the challenges they're facing, and the impact that their caring role has on various aspects of their life. This means we can take a very personal approach and work together to understand their needs and goals and identify the support they need to achieve them, which naturally determines the next course of action. Then we can tailor our information and support specifically to their circumstances. Some of the information that we can provide includes helping them to access services, devices and equipment to assist them in their caring role, information on local support and services, helping them to understand the condition of the person they're caring for, and supporting the carers to prepare for a carer's assessment. In some cases, a carer might need more support than information or advice. in which case we might look to provide some more focused interventions in the form of either coaching or counselling. Coaching is a series of purposeful conversations which enable carers to identify and move towards goals. For example, carers may be struggling to balance their work with their caring role, or to stay connected with friends and not become socially isolated. A coaching approach shifts from providing facts to actively supporting the carer in developing their own skills, capabilities, and solutions. We also have a counselling service available where carers can receive up to 6 free counselling sessions with a trained counsellor. These sessions are available face-to-face, online, and over the phone. I'm going to hand over now to Emma to tell us about the rest of the service.
Morning everyone, it's great to see so many people. So alongside all of those things that we're all offering, we know that caring can be really isolating, and sometimes knowing that you're not alone can really help. So across Essex, all the services are running peer support groups. These can be face-to-face and are online. During this time, carers can meet other carers, reduce their isolation, gain support from the member of staff that's running the group, and have a well-needed break by coming along to the groups. Alongside that, we know that sometimes coming for a cuppa just doesn't quite cut it for a break in your caring role. Through an assessment from either organisation, depending on where the carer lives, it might be identified to help improve a carer's well-being, some money towards an activity or a break from their caring role would be really beneficial. So we can also look through an eligibility criteria and assessment whether a grant would be appropriate to support an improvement in their caring role. We wanted to share some of the impact and the outcomes. So we had feedback that 96% of carers feel more resilient in their caring role through support that they've accessed. And our main aim is to improve that resilience so they can maintain that caring role for as long as they wish to. And some quotes from carers as well, expressing their appreciation, how professional the team have been, the guidance and the meaningful support, and having knowledge and support and the relevant tools has helped carers to get where they are now, feeling confident in their caring role and positive moving forward. I'm going to hand back to Lisa, who's going to share some of Action for Family Carers feedback and their contact details.
Thanks, Emma. As Emma said, there's been a really incredibly high demand for all aspects of the service, and we've received excellent feedback from carers that we've supported. 97% of carers said that they felt valued and listened to. And one carer who received coaching told us, having the knowledge, support and relevant tools has enabled me to get where I am now. I feel confident in my caring role and positive going forward. And another one said, thank you so much. You've been amazing and brought me to tears. I didn't think anyone cared what I was going through. You have restored my faith in humanity. Thank you. Action for Family Carers is an Essex-based charity who've been making a positive difference to the lives of unpaid carers for over 30 years. Referrals can be made direct through our website. You've got the link there on the screen, or also via EWS.
Contact details for Carers First. We provide tailored carer support to people living and caring for somebody in Mid and South Essex, as displayed in the video earlier on. Referrals can be made direct through our website. Details for all of the groups and events can be found on both websites, Action for Family Carers and Carers First. On the screen are our phone numbers and our website. I'm handing over to Jack.
Thank you, Emma and Lisa. Hello, I'm Jacqueline Tulip, and I'm the Operations Manager for Adult Social Care Connects and Countywide Duty Team, so the front door to adult social care. But in adult social care, it's not just the front door that undertakes carers assessments, it would be the wider adult social care, so in our neighbourhood teams as well. So adult social care provides statutory carers assessments and the delivery of our support plans. And adult social care should be contacted when the carer has requested a carer's assessment. The situation might be complex or high risk, or there might be safeguarding concerns. And it could also be when the carer assessment relates to a requirement for the cared for person. So somebody they cared for might be in receipt of care or needing to be receiving more formal care. A support plan can access various outcomes. So it could be that we use technology-enabled care, so digital technology. We can provide manual handling training, carers emergency planning, and carers direct payments for identified needs and outcomes, or a combination of those elements. You can see the feedback that we've received from our carers, but I think the most significant thing that resonates with me is that what we often hear is how carers feel listened to when they're having a carers assessment with us. So I think that can be really empowering for people when they feel that they're heard and they're listened to and have the opportunity to share what's happening in their lives. And the carers assessment is about the carer, it's not about the cared for person. So at this point, I think I'm handing over to Ben.
Thanks, Jack. So just to briefly summarise in front of you some of the sort of the key options and pathways that we've spoken through. So there's the Essex Wellbeing Service, which is very much that central point of contact. If you're not sure where to go, start there, and they'll provide that light touch triage and advice. They'll either provide that advice there and then, or they might send the carer to a specialist organisation. One of those organisations might be Action Family Carers and Carers First, as spoken through earlier by Lisa and Emma, and they'll provide that specialist information and advice, as well as if someone needs counselling or coaching support or a wellbeing grant, they can provide that as well. And then I won't repeat too much because Jack just spoke about the adult social care offer, but if a carer needs that extra bit of complex support, then please do also signpost and refer them into adult social care for that statutory assessment. What I would say as well is that there's quite a lot of information we've shared with you. So there's a bit of a summary here in terms of contact number and sort of referral forms that were sent out with the slides to everyone. But also just to also say that we do have a no wrong door approach in Essex, which essentially means that if someone does go to the wrong place, or if actually their needs change over time, so actually they need to go from one provider to another, then all the providers will talk to each other and will refer them into as and when needed. And then this was just to briefly mention as well that we've spoken today about some of the main places to go for carers, but actually there are hundreds of organisations that are supporting carers either directly or indirectly across Essex. And unfortunately, in just the half-hour webinar time, we didn't have time to cover them all today. But this work wouldn't be possible without all the people that you can see in front of you and many more that sit behind this. So just a thank you really to all the providers in Essex that are supporting carers. Yeah, we couldn't do this work without them. And then final point for me, just before we close, is just to say that there are a few webinars, as Simon mentioned at the start, there's a few webinars taking place, one every day this week. So we're on Tuesday, but there's a couple more. So tomorrow's is focused on supporting carers of people with dementia. Thursdays is focused on advocacy support for carers, and Fridays is focused on employers support for carers. If you're interested in attending any of those, please do. We'll send the booking link in the chat in a moment. I'll pause there for about 30 seconds just to give you a chance to look at that. Hopefully you can see in the Q&A the link to book in if you're interested. And you can go back a slide, please, Natalie. And then just to finally say thank you so much to everyone that's joined. Thank you very much for the presenters. Thank you so much for the time, recognising that we know how busy you all are, but it's so important that we get this right. So just a massive thank you and hopefully see you soon. We'll close the webinar. Thanks.